Edutainment Studios welcomes you to Autism Spectrum Disorder, Beginning to Understand. This module is part 7 of a 9-part series. Autism is not a single disorder, but a spectrum of closely related disorders that have a shared core of symptoms. Every individual on the autism spectrum has some degree of difficulty with social interaction, empathy, communication, and flexible behavior. However, the level of disability and the combination of symptoms varies tremendously from person to person. In this course, the objective is to help you identify the alternative medicines that are available to help with ASD. Because autism spectrum disorder cannot be cured, many parents seek alternative or complementary therapies. These treatments have little or no research to show how effective they are and can be potentially dangerous. They could unintentionally reinforce negative behaviors in your child. If you are considering any therapy for yourself or your child, talk with the doctor about the scientific evidence of any therapy you are contemplating. There are some complementary and alternative therapies that may offer some benefit when used in combination with evidence-based treatments. Creative therapies are often chosen to supplement educational and medical intervention. These can include art therapy or music therapy, which focuses on reducing a child's sensitivity to touch or sound. Sensory-based therapies are based upon the unproven theory that people with ASD have a sensory processing disorder that causes problems tolerating or processing sensory information, such as touch, balance, and hearing. Therapists use brushes, squeeze toys, trampolines, and other materials to stimulate these senses. Research has not shown these therapies to be effective, but it is possible that they may offer some benefit when used along with other treatments. While massages may be relaxing, there is not enough evidence to determine if it improves symptoms of ASD. Pet or horse therapy can provide companionship and recreation, but more research is needed to determine whether interaction with animals improves symptoms or not. Some complementary and alternative therapies may not be harmful, but there is no evidence to support their helpfulness. Some may also include significant financial cost and can be difficult to implement. There is no evidence that special diets are an effective treatment for ASD. In addition, restrictive diets implemented on growing children can lead to nutritional deficiencies. If you decide to pursue a restrictive diet, work with a registered dietitian to create an appropriate meal plan. Although not harmful when used in normal amounts, there is no evidence that vitamin supplements and probiotics are beneficial for ASD. Supplements can also be expensive. Talk to the doctor about vitamins and other supplements and the appropriate dosage for you or your child. Acupuncture therapy has been used with the goal of improving autism symptoms, but the effectiveness of acupuncture is not supported by research. Some complementary and alternative treatments are not recommended for ASD at all, as they are potentially dangerous. Chelation therapy is said to remove mercury and other heavy metals from the body. It is not recommended for patients with autism, as research does not support a link between the two, and it can be very dangerous. In some cases, children treated with chelation therapy have died. Hyperbaric oxygen treatment involves breathing oxygen inside a pressurized chamber. This treatment has not been shown to be effective in treating ASD symptoms, and it is not approved by the FDA for such use. Intravenous immunoglobulin, or IVIG infusions, provide antibodies intravenously. There is no evidence that using IVIG infusions improves this disorder, and the FDA has not approved immunoglobulin products for this use. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 7 of 9 on Autism Spectrum Disorder, and please join us for Part 8.